Hello everyone, welcome back. Today we'll discuss about a girl with swelling and pain of the wrist and knee. She is the MCQ. A 38-year-old woman being treated for hypertension and diabetes presented to her GP with a sudden onset of swelling and tenderness of the wrist and knees. On examination, she is febrile and flushed. A friction rub can be heard at the left lower sternal border. We asked about which of the following drugs is most likely the cause of these findings. We are given answers: Metformin, Hydralazine, Minoxidil, Nitroprusside and Propranolol. Now you are familiar with my style. So what's the first step? Yes, we'll identify and underline the keywords first. This will take only few seconds. So what are the keywords here? Obviously the age. She is a 38-year-old woman. Woman is an important keyword here, and she is being treated for hypertension and diabetes. She presented with sudden onset of swelling and tenderness of wrist and knees. And febrile, flushed are also important keyword. A friction rub can be heard at the left lower sternal border. So this is a bit tricky question and we are not given a clear diagnosis here. So with the history, you must come to diagnosis and then you must think about, okay, what is the drug that will cause these symptoms? Now let's get into the answer. The answer is B, Hydralazine. Okay, why B is the answer? We'll discuss now. From the case scenario that you must come to diagnosis that this is a case of drug-induced lupus. And drug-induced lupus, it's a form of lupus caused by medication. If you search or if you look at guidelines, the first drug that is given that is known to be cause drug-induced lupus is Hydralazine. It's a very famous drug. And drug-induced lupus causes symptoms similar to those of SLE such as arthritis, rash, fever, chest pain, but not kidney disease. Keep in mind this is an important fact. And usually drug-induced lupus, it goes away when the drug is stopped. So these are other medications that cause drug-induced lupus: procainamide, methyl-dopa, quinidine, isoniazid, phenytoin and carbamazepine. These are few other common drugs that cause drug-induced lupus. This condition, drug-induced lupus, is more common in females. That's why I told you guys earlier, the fact she's a woman is more important. It's more common in slow acetylators because the metabolism of hydralazine is reduced in these patients. And also people with HLA-DR3 antigen, they are at a higher risk of developing drug-induced SLE. Slow acetylators have a genetically determined inability to acetylate the amine or hydralazine moiety of drugs. And the process is like this. Non-acetylated metabolites accumulate, they bind to nucleoprotein or cellular macromolecules, form an antigenic complex and induce an autoimmune reaction. So this is a sequelae. This is a good to know thing. Coming back to the MCQ, the option A is metformin. No, it's a biguanide oral hypoglycemic and it's not known to cause drug-induced lupus. And minoxidil is a prodrug. It causes dilatation of arterioles and it's used for androgenic alopecia and it isn't known to cause drug-induced lupus. Nitroprusside is a non-selective vasodilator and propranolol is a beta blocker. And these two are also not known to cause drug-induced lupus. So the best answer here is Hydralazine. Although this is a bit tricky, it's straightforward. Like complications of Hydralazine drug-induced lupus is a well-known thing. I hope you understood this MCQ and the explanation. So let's meet from another MCQ like this. Don't forget to subscribe my YouTube channel for more videos like this.